Okay. Hi, guys. Thank you for joining the live session. So today I have chosen an important topic. Hopefully, it is a very impactful topic for all of you. It is during your medicine residency, how to absorb maximum specialty knowledge from the different super specialty units that are there in the hospital. This will be a practical, probably a high strategy guide for all the MD and DNB residents who are logging on to it or are going to view this particular video over time in due course. So, why have I chosen this topic? Does this really matter? Believe it or not, super specialty fields contribute more than 60% of internal medicine questions, decision making, and referrals. So, an early exposure to super specialty units will increase your clinical reasoning, your referral quality, your exam performance, and also most important is currently is a world of confidence, right? We'll have to be confident before our seniors during rounds and calls and even during the patient. Overall confidence would definitely give you a high five to your career, which is in front of you over time. So most important thing is, what does a super specialty knowledge mean? Okay, it doesn't mean that it is just about memorizing an entire DM book. That is a big misconception. Okay, even if you look at Harrison's, you have different units. You are completely thrown into an ocean of knowledge, so your nature to actually assimilate so many things into a strategic way called smart reading becomes very essential during your medicine. So, a super specialty knowledge to a physician or a PG resident means that you are aware or are going to learn the core principles of each specialty. You will be able to pick up red flag situations and know how much extent you can treat and when exactly to refer. You should also know what are the high yield investigations that you should be ordering instead of a plethora of investigations that could be done in a different conditions. Okay, most important from a patient perspective would be immediate management steps that will help you do the right thing to the patient. This is what makes a strong medicine resident. Okay, now, major super specialties to focus on are the general ones which are already there in majority of the medical colleges. To name a few, these would be cardiology, gastroenterology, nephrology, endocrinology, pulmonology, rheumatology and immunology, hematology and oncology, infectious diseases, and critical care medicine. Okay. Now, critical care medicine also is important unit, especially when you are in your 2 month postings or a few months of postings in ICU. You will be able to learn how to do a quick assessment and do the important treatment that is essential for the first few steps and get the physician mindset on why things are happening. Few things has to be done out of knee jerk and few things has to be done from a systematic analysis so that you would be able to get the diagnosis correct. So I would like to briefly give you a simple rule of 70, 20, and 10, where what's most important is 70% of the time your core medical knowledge, where history, examination, understanding the physiology, pathophysiology, different form of therapies, assessment of ECGs, ABGs, and your basic fluids are basically most important in all conditions. 20% your super specialty summaries, like what you exactly know when you find out a situation. You should have guideline triggers, when to refer, and when to ask for the best investigations. Okay, these becomes important. Like sometimes you would have to send a CT scan, you might have to do a lipase test, you might have to do different tests based on your preemptive probability of the diagnosis. Okay, these becomes important. 10% of the time it is about deep diving into one or two areas of your interest, like it could be GI, cardio, and neuro. So even for a consultant like me sitting in my OP and seeing patients, it's more important that our core medical principles are important, and subspecialty branches are also important. And then a part of it becomes deep diving into this. So this is a simple rule which you guys can remember. Please, medicine is most important, so use all your time to understand the basics. Then comes super specialty summaries. At last comes deep dives in SOS basis to understand things more clearly sometimes, which I'll come in due course. Now, I see that there's something called as micro learning method, daily micro learning method. It's like you guys must have read the book called Atomic Habits, where a huge chunk of things or work or target can be split into really small ones, enjoyable ones, to ultimately achieve what you really need. So what I suggest for every PGs is should follow these 4-step routine. First, see a case. It could be as simple as ACS, seizure, AK, or upper GI bleed. First is the case. Then identify the super specialty angle to it. Read at least one page guidelines. I don't suggest usually reading full guidelines of 20, 50 pages. You would have just the important guidelines, lines, or recommendations to read. And then if you have a doubt, just read that specific thing. Then comes, you should make at least 3 high yield points on the specific case that you are seeing. If you keep doing this on a daily basis, see, you are reading something, reading a guidelines in a brief way, and making 3 high yield points. Those 3 high yield points should be written in a particular book. It could be notes or whatever you can access quickly. Remember, if you keep doing this every day, that micromanaged learning that you're doing is ultimately going to give you within 6 months at least 150 to 200 super specialty pearls, which will be very important for you from an exam and specialty perspective, especially with respect to managing the patient. Next, some strategies for on duty, what to do during your night duties. Don't randomly Google stuffs and read in an unstructured way. Preferably use some important things, like your sources should be up to date summaries. I'm also re-mentioning summaries. You may not have time to read the entire thing, but the summaries at the end should be very well known, and at least 3 high yield points from that you should take. Current medical diagnosis and treatment is something which keeps changing every year, and going through this will really add on. They also have an entire newer section of what are the new studies that based on which some important recommendations are changing. And of course, Harrison's clinical tables and algorithms are something important, and you would have a specific hospital protocol based on whichever hospital you are to actually go through. And always ask, what would the DM person do next? Okay, if you have that mentality, you would start thinking. Otherwise, it would always be a messenger role where somebody else is telling you something and you would be doing it. No. What would they do and how much you are right in what you're doing? Over time, that will build up a lot of confidence. Okay, guys. Yeah. From an OPD perspective, in the outpatient, what I would want you guys to do is follow one super specialty unit or a consultant consistently, because it is a very humane thing that each of us are different. Our pattern of thinking is different. Our things may be different of how we see or the lens we use to approach any problem. If you assess and you like someone, try to associate with them more frequently so that patterns start forming in your mind also. Observe the different patterns, what investigations they repeat often, what they ignore, how they classify the severity, how they counsel a patient, what are the different aspects that they are covering. Now, this is going to fast track your thinking to a super specialty level. Okay, so these are very important from an OPD perspective and an inpatient perspective also. I've already told you. When you're doing ward rounds, what are the strategies to be done? Identify one pearl per case. Okay, then ask focused questions. Sir, why do you choose this test first? What is the threshold for referral? What When do you start a steroid, anticoagulation, antibiotics, etc.? Keep a pocket note, or of course the recent gen have different apps like Notes and Notes Plus, this that you can use them also. Limit your notes to one line per day. That's how you get to retain. Okay, so when you have least information written and high yield points, your ability to recall things using what you have written becomes very good. And over time, imagine the number of cases you would see and the high yield points that you have written. So I would say, if you have one case, write a pearl, read about them, and just remember three important key clinical important points for them. Now you'll become more specific. So when you have a case, you have to have focused questions and have a clear answer for that particular question. And from a specialist perspective, if you're able to ask them and find out an answer, you would retain it much better if you know very little specific points. There is no point in knowing everything. It should be specific answers for specific situations. Okay. Second, what I would want to tell you is how to use your consultations effectively, especially when you call a super specialty consult. Slowly develop the habit of presenting the case in a short and structured format. I'm also a consultant and also see a lot of medical students calling me for different referrals. So when a student as a medicine PG is telling me, so a 35-year-old male patient with these comorbidities, with no past history of surgeries, currently presents with these complaints, with key investigations being so and so, this is what I'm expecting from you. What could be the next step? Now, when you ask such a structured format, you will start developing the knack of what's real important point to grasp from what the super specialist needs to tell. Okay, so first learn to tell the background, try learn to identify the red flags to tell in a crisp way. Key labs, nobody's interested in knowing everything. Key labs also is a technique which you will start developing over time. And what you want from the specialist is important. Observe, just don't see what they're writing and telling. Always observe them, how they reinterpret the case from their point of view or their angle. This is the fastest method to learn their thought process. Now, thought process is one thing. Second is, there are basic skills which all of you can learn from a super specialist. Like a medicine PG can always go to a hematologist during referral, say example pancytopenia. You are thinking of myelodysplastic syndrome, how to approach it. When sir is doing, or a consultant is doing a bone marrow aspiration and biopsy, how are they doing? Is it something which I also would want to learn? Is it something that would help me further my career? Okay, as a medicine PG, you should be able to do so many basic procedures, and you should learn specialty dependent procedures also from your consultant. From a gastroenterologist perspective, when you are meeting them for some case, or you're referring a case for any procedure, you can always do the background work of whether antibiotics is necessary, whether diclofenac suppository has to be given before ERCP, whether the antibiotic dose has to be changed, how to give colonoscopy preparation before the procedure, sedation, pre-anesthesia checkup, this, that. You would have a lot of idea and a scientific way of doing things. And when a specialist is telling you that this is what he's expecting, and in a crisp way, when he tells you, your memory or your brain starts sticking to important facts. Okay, and that will help you further your career in a very, very smart way. So There are three S rule for rapid learning, which is easy for you guys. Learn only these from each super specialty for different problems. First S is syndrome. Okay, S1 is syndrome. Example, nephrotic syndrome, ACLF, DKA, stroke types. Okay, syndromes. Next S2 is scores. There could be different Chadwick score, MELD score, Curve 65, Well score, Apache score. Third S is steps. Example, if you have stroke, CT, thrombolysis, BP goals. Okay. For upper GI bleed, you could have resuscitation followed by upper GI scopy, followed by post-procedure monitoring. So these are the steps. Got it? You have acute pancreatitis, you have severity scores, and then you have management first day, fifth days, first week, second week, third week, fourth week, etc. So this 3S rule will also help you start analyzing from a systematic perspective: syndromes, scores, and steps. Okay. So memorizing things in these three categories generally makes your problem easier, classify things much better in mind, make your situation more crisp, and tell the consultants and manage the patient more importantly. This three steps is 60% of your DM knowledge. Okay. Then what books to follow? Super speciality in 1 or 2 pages each is most important. You should not be able to, have an entire book, inside your head. It's just not feasible. So Harrison's algorithms and tables are the best ways to start, but some may be complicated and may make your life difficult. So always have few extra other books like Washington Manual of Medical Therapeutics, up-to-date overview page, Oxford Handbook for quick decision making. Sometimes some of them may be not comfortable with Oxford because the units are a little different from Indian and whatever they're using. It's in millimoles and this, that. So you may be a little confused, but at least the quick decision making process might really help you. Current medical diagnosis and treatment is something during my residency felt really good. Okay. Then also will make a good impact during your practice. At your PG level, reading entire DM book generally is waste of time. But some students, I would say, actually are able to do it in a smart way. They don't read it line to line. Suppose they have a quiz, say hematology quiz. You have 2 weeks time. You get the standard book and quickly try to revise the entire important facts, and what are the important key factors for the quiz to read, which future could help you in some or the other format. Okay, these are important things. But reading all standard textbook of all subjects, generally we have limitations of time, which is humanly not possible for the general population who are doing MD or DNB medicine. Next comes weekly super specialty timetable. Now, even if you have a 15 to 20-minute topic you want to read each day from different topics, even this approach is good. Just 2 hours per week is enough, and the knowledge gained is huge. Like each day, if you just spend 20 minutes for a specific topic of difference, you can make these rules. Every day I'm going to read different subjects or topics and read one specific thing, and over time that multiplies, because this also will add on to your case high yield point, which will really help you with your practice. Okay. Now, last but not the least, case based learning is the way to go. Case based learning is the king. So case formula is something which I want you guys to follow. C for chief problem, A for approach with different steps, S for severity and scores, E for escalation, that is when to refer or when to shift the patient to ICU, etc. Say, for example, you have a patient with acute pancreatitis. C, there is pain and vomiting. A, how are you going to approach? First thing is lipase. Some people tell you an amylase, this, that, everything, but then lipase is more specific. So just do one test, ultrasound, and then followed by CT if needed. Okay. Scores, severity, that is BISAP scoring. E is ICU if organ failure and raising scores. So this case formula is going to help you. One, you are seeing a case, and then you have formulated the chief problem, chief investigation, severity scores, and when to escalate and what to do. So this pattern is also going to play a major role in your clinical assessment. What are the best apps for PGs to actually go through in your medical residency? There are various scores you have to keep. You can't memorize everything because many of them are logarithmic also. So MedCalc is something which you can use for scores, up to date for the crisp knowledge they give. ECG Buddy, QXMDs are there for the journals. There's some app called QXMD Read. Radiopedia for good radiological information. Geeky Medics are there, few things which you can use for crisp placards and points. PubMed clinical queries are also good sources. Use these instead of searching thousands of random pages. Okay, this is during your residency. Now, here is where Doc Tutorials app has come with something specific. Here you have an entire PG residency course actually spoken by experts of each department, giving you high yield points and giving you a way on how to think like a super specialist, which could also be used from a very, you can use it like subject wise, each subject weekly basis, and finish off them, which is really going to help you with your clinical practice and also your entrance exams, which you'll be facing in the future. Okay, so these are few things which I wanted to share. And then how to avoid overwhelm. See, from far, when you see a lot of elephants coming to you, it looks like a mirage, but once it starts coming near you, you start feeling overwhelmed. Okay, now that is the issue with medicine as a branch, because it's too overwhelming. So how to avoid overwhelming? So do not, first thing is, do not aim to master super specialty level during residency, but master to know the high yield point for different important clinical situations, which is not difficult. Okay, aim to understand the first 70% lies in just approach, emergency management, and referral point. That should be your aim, not to master and become a kung fu black belt immediately. It's just not possible. If you have that and the time is limited, it just is going to be too overwhelming. Okay, learn daily 15 minutes and not beyond 2 hour session is what I would say. This is enough. Least you read, mind keeps things more. And I see a lot of groups with so many PDF overload. Please avoid all of this. These are not going to help you much. Only when you're free time, you can do it for hardly something. What I would want to tell you is there are a lot of cheap dopamine available around. Don't waste your time in all the shorts and instas, this, that, and everything. Okay, when you're focused, be focused. You know that the dopamine rush that comes from actual hard work and smart work is much, much, much more than the cheap dopamines and distractions available around. So remember these things, guys. They are really going to matter a lot. Most important practical tips from seniors, very important. Follow one consultant per super specialty to get a style properly. Otherwise you'll be, switching styles will confuse people. Focus on the patterns, not facts. Okay, facts are useless until and unless you know to connect the dots. Just knowing facts is absolute waste of time. Present concisely. Get the art of presenting cases in a concise manner. It's very easy. Attend procedural postings seriously, because they are very important. You might get to learn few things and then implement your medicine also. Spend at least 1 hour per week in ICU. Best high yield learning environment happens in these places also. Okay, so guys, there are enough knowledge around, especially with the technology. Things are at your fingertip. See, case is the most important ways of going about things. How to use your DM postings is very important. Like let it be cardio, GI, nephro, neuro posting, anything. Always think in terms of make a top 50 list of cases, investigation, threshold decision. These are going to really help you. Observe the consultant's thought process. Ask for pattern recognition tips. That's most important. Okay, they will have a lot of stories that I saw this patient, this is the presentation, this is what we did, ultimately turned out to be that, and that is going to help you. Last but not the least, don't chase for rare cases. Master the common ones in the right way, in the most specific pattern, and that's what is really going to matter. Okay. Now, what are some do nots? Okay. What not to do is also important. Don't try to study the entire DM syllabus for all the branches. It is definitely overwhelming for normal human beings, which are most of us are. Don't become a guidelines robo. Understand the physiology. That's more important. Guidelines are just meant to guide you, and different guidelines can sometimes tell you different things. They are just to guide you. So understanding physiology and then the guidelines makes more impact. So you have to connect two things: guidelines with your physiology. Don't depend only on juniors. Okay, that's also important. Complete dependent on your work for juniors is just not going to help you. Seniors are there to help you, and you have to teach your juniors the right way to go about things. Don't study without seeing patients. It's absolutely not recommended. Patients are number one. When you see a patient, pattern recognition becomes much easier. Don't waste searching for the best notes, best textbooks. These are a myth. It's a relative phenomenon. Start making notes, and high yield notes, easily kind of recallable ones, easily revisable ones. These are the ones which will really help you. Don't copy seniors blindly without understanding the reasoning. Don't get scared to ask why. Why are important things. Seniors don't know why, then ask their seniors. They will read and come back to you. That's more important. No, don't ever feel wrong asking why. Why is very, very important. Next is how to know you are improving. That's more important. You need a feedback system. You will notice few things. Your referrals get shorter and sharper. You can predict what the DM consultant's decisions are. You can defend your management in rounds. You will feel confident in emergencies. OPD becomes more enjoyable. You can teach your juniors easily. These are all the points that will tell you that you're actually improving. These are the key markers of genuine learning, guys. Key markers of genuine learning. So final take home message from my side is you focus on the case, okay? Approach, severity, when to escalate or when to refer. These are important, and master these, then you will master your super specialties. Okay. So thank you for this great opportunity, and hope you guys are able to grasp important facts and try to apply it every day, little bit. So over time, you are going to be a knowledge bank. Okay. So residency is not about just reading more, it's about learning smarter. And remember, it's a lifelong process. Thank you, guys. Thank you. Any questions or discussions, it's most welcome. And you all know that there is a special group for all the gastroenterology interested PG residents. You can join my group. You can take the number from us. Okay. So great. Very happy to know. And I know that there'll be many questions over time. And I would like to share our WhatsApp group through our management. So you guys can join there. There's a lot of discussion going on from gastroenterology perspective. But however, from medicine PG residents perspective, I hope this particular session would really, really, really make a change in how you approach a residency, guys. Thank you. We will be answering your chat, the questions in the chat box on a personal basis in due course. Thank you and have a nice day.